Understanding Bipolar Disorder. Welcome to our latest video, where we delve deep into the often misunderstood topic of bipolar disorder. Please like and share this video. Also, please subscribe to our channel. It's free for you, and helps support us to make more educational videos about health and well-being. Imagine living on a roller coaster, not of steel, but of emotions. This is the reality for those facing bipolar disorder, a mental health condition that propels individuals through extreme highs and lows. Bipolar disorder, once known as Manic Depression, paints life with unpredictable strokes. It crafts episodes of deep sadness and despair, only to thrust sufferers into periods of heightened energy and euphoria. During depressive phases, the world may seem shrouded in shadow. Tasks once simple now appear insurmountable. It's a time when hope feels distant, and joy seems a foreign concept. Then, like the sun breaking through clouds, mania arrives. Energy surges, sleep becomes trivial and the mind races with grand ideas. However, this sunlight can burn, leading to reckless decisions and impulsive actions. Hypomania, a milder form of mania, presents a deceptive allure. It's often where creativity blossoms, yet it teeters on the edge of danger, a warning sign of a potential storm ahead. The switch between these states isn't predictable. It can be gradual, like the onset of twilight, or sudden, akin to a storm's abrupt arrival. This unpredictability is a hallmark of bipolar disorder. Behind these shifting moods lies a complex interplay of genetic, environmental, and neurological factors. It's not simply a matter of being sad or happy. It's a profound disruption in the brain's chemistry and structure. Diagnosis by a mental health professional, like a psychiatrist, involves thorough examination and patience. It's a puzzle pieced together through personal histories, symptoms, and sometimes, the elimination of other conditions. Yet, understanding is the first step toward reclaiming control. Treatment is multifaceted, combining medication, therapy, and lifestyle adjustments. Medication helps balance the brain's chemistry, while therapy provides tools to navigate the emotional turbulence. Lifestyle changes, including regular exercise and sleep, play a supportive role. They are the bedrock upon which stability can be rebuilt, offering a sense of normalcy amidst chaos. Support from loved ones, or support groups, becomes a beacon of light. It's a reminder that even in the darkest moments, no one needs to face the storm alone. Their understanding and patience can make the journey less daunting. Yet, stigma often shadows bipolar disorder, painting false pictures of weakness or instability. Breaking this stigma starts with conversation, with sharing stories and truths about the condition. This script isn't just information, it's an invitation. An invitation to look beyond the disorder's challenges and see the individuals fighting to find their balance, to live a life not defined by extremes. Bipolar disorder is a lifelong journey, but with the right support and treatment, it's possible to navigate its waves. It's about finding stability in instability, and discovering that even amidst the chaos, there's hope. Remember, you're not alone, and help is available. If you, a loved one or a friend, are displaying behavior associated with bipolar disorder, then consult a doctor, who can refer to a psychiatrist. We have more educational videos about health and well-being, so make sure you check them out. Stay safe and take care. Your health matters.